Hi friends, my name is Nicole and I'm a registered dental hygienist. Did you know that a healthy mouth is important for a healthy body? In fact, right this second, scientists are researching how the health of your mouth can affect the health of your heart, your lungs, your brain, and more. Your dentist, hygienist, and the people who care about you want you to have healthy teeth and gums, so you can look and feel your best when you're speaking, eating, and playing. Today, we're going to look at some of the things that you can do at home, at school, and in the dental office to help keep your teeth as healthy as possible. Up first, we're going to talk about how what we eat can affect the health of our teeth. There are over 700 different types of germs living and growing in your mouth. Isn't that wild? Another word for germs is bacteria. These bacteria are very, very, very tiny and live in dental plaque. Dental plaque is a sticky, goopy, white to yellow coating that grows on your teeth and around your gum line. It can be easily removed by brushing and flossing. Tartar is a hardened version of dental plaque. Tartar can't be brushed away and must be professionally removed during a dental cleaning. If it isn't removed, it attracts more plaque, irritates your gums, and can cause gingivitis. Some of the bacteria living in your mouth eat the sugar left over after we eat and turn it into acid, which builds up in dental plaque. Sugary foods like candy and sweet treats create more acid than others. If dental plaque isn't removed, the acid can cause bad breath, sore gums, and over time, it can break down the hard outer layer of your tooth called enamel and make a hole. The hole is called a cavity. One thing that you can do at home and in school to help prevent cavities is to eat foods that are low in sugar and drink water instead of sweetened drinks like juice and chocolate milk. Our favorite tooth healthy tips are to eat foods that grow in the ground and in trees as often as possible. Fruits, veggies, and nuts are great tooth healthy snacks. Next, we're going to talk about the easiest way to get rid of dental plaque: brushing and flossing. This is my pal Tilly, and he has a great set of chompers. So I'm going to show you how to brush your teeth using Tilly. You should brush your teeth twice a day using a pea-sized amount of fluoride toothpaste. It takes about 2 minutes to brush all of the surfaces of your teeth. The first thing you're going to want to do is pick the right toothbrush. So you want one that has soft bristles and a small head with a nice handle that you can hold on to. We're going to start by brushing all the outside surfaces of Tilly's teeth. Take your toothbrush and put it at your gum line and gently massage in a circle. You're going to brush all of the top teeth and all of the bottom teeth. It's important that your toothbrush bristles tickle your gum line in order to get your teeth clean. The next surfaces we're going to brush are the biting parts. So these are the parts that you see when you open really wide, and it's the flat top part. To brush these, you get your toothbrush bristles and gently brush back and forth to get them all clean. Brushing the inside surfaces of your teeth can be a little tricky. What you're going to want to do is tip your toothbrush so that you can gently massage on the insides on the bottom and the insides on the top. To clean your front incisors, you're going to flick your toothbrush just like this to get those clean. After you brush your teeth, it's a good idea to brush your tongue too, because dental plaque can actually get stuck on there and cause bad breath. To do that, lick your tongue out and gently brush back and forth. It's okay to ask an adult for help if you feel like you're missing some areas. Up next, we're going to show you how we clean in between your teeth to help keep your gums healthy and prevent cavities. We floss our teeth daily to remove dental plaque and food that's stuck in between that our toothbrush just can't reach. You can either use string floss or floss that comes in little floss sticks. Today, I'm going to use a black piece of string to make it easier for you to see. So you take your floss, if you're going to use string, and wrap it around your fingers. I like to use my middle fingers. You want to have a little piece in between that's tight so that you can guide the floss between your teeth and under your gum line. I'm going to gently wiggle it down and slide up and down just below the gums. Flossing with string can be a little tricky. It's okay to ask an adult for help. Up and down, up and down. Now, if you find that it's a little bit difficult, you can also just start with a floss stick. So floss sticks hold the floss tight, just like I did between my fingers. They work the same way. You're going to take the floss and gently wiggle it between your teeth, and then go gently below your gums, up and down, on each side of the tooth. If you find this difficult, ask an adult for help. Remember, flossing daily is a really important part of having healthy teeth and healthy gums. Up next, we're going to see what it looks like to visit a dental office. Let's meet the dental team. When you first walk into an office, you'll likely meet the receptionist. They say hello when people come in, answer the phone, and book your next appointment before you leave. Dental hygienists clean tartar, stain, and plaque off teeth. They help you prevent cavities by giving you fluoride treatments and measure the health of your gums. Dentists are doctors who examine teeth. They fix broken teeth and place fillings in cavities. Dental assistants sit next to the dentist. They help do fillings and make sure you're comfortable during your appointment. Another person you might meet is the office manager. They help keep things running smoothly and organize the office. Dental professionals wear clothes to help stop the spread of germs. When you first see your dentist or hygienist, they may be wearing regular clothes with a lab jacket or scrubs. Before they look in your mouth, they might change into extra special clothing, including a gown, hair covering, gloves, mask, eye protection, and a face shield. Every dental office is a little different, but here's what it looks like when someone visits us for a dental cleaning. When they first come into the clinic, they are in the waiting area. The receptionist will say hello, and they may take your temperature and ask you to sanitize your hands. They may also ask the adult who's bringing you to your appointment some questions about your health. After that, you'll be asked to take a seat and you'll wait for your dental hygienist to come get you. This is Toby. She's a registered dental hygienist, and today she's cleaning Shannon's teeth. In the dental office, you'll see dental chairs, dental equipment, teensy tiny tools, computer screens, and chairs with wheels that your dentist and dental hygienist can sit on. Before Toby cleans Shannon's teeth, she's going to put a bib on to keep Shannon's shirt clean. And as you can see, she's already wearing her special protective clothing. Dental chairs are super cool. There are buttons on the side that we can press that make the chair tip back so that it's easier to look in people's mouths. The chair moves slowly and we can move it up, down, and back and forth. The first thing Toby's going to do is she's going to shine a light in Shannon's mouth and use a tiny mouth mirror to look at her teeth. Next, she's going to use a tool called an explorer to count and explore Shannon's teeth. Dentists use this tool to find soft, sticky pits in teeth called cavities. Next, Toby is going to use a tool called a probe to measure the health of Shannon's teeth. This part doesn't hurt. Do you see how small the ruler is? It's actually measured in millimeters. Next, Toby's going to remove tartar that Shannon can't brush or floss away. She uses a tiny tool called a scaler to gently scrape the hard deposits off of Shannon's teeth. Next is the most fun part. This is the polish. Toby's going to use a special toothbrush and toothpaste to polish stain and dental plaque off Shannon's teeth. She's also using a mouth vacuum cleaner to catch any toothpaste that flies off. Next, Toby's going to rinse the toothpaste out of Shannon's mouth using a tiny water sprayer and a suction called a saliva ejector. The saliva ejector is a teensy tiny vacuum cleaner for your mouth. Now Toby is going to protect Shannon's teeth by applying a fluoride treatment. This is a super easy step we can do to help protect your teeth and prevent cavities. At the end of the visit, Toby's going to take the bib off Shannon and sit the dental chair up. That was super easy. Let's take a closer look at the tools that Toby just used. I'm going to show you using this teeth model. This is a mouth mirror. It's teensy tiny and fits in everybody's mouth. Next up, we have the Explorer. This is a tool that dentists and hygienists use to assess the health of your teeth and gums. It's great for counting teeth and also for exploring the biting parts of teeth. We can actually find cavities with this tool. This one is called a probe, and it's actually a teensy tiny ruler for your mouth. Dental hygienists use this tool to measure the size of your tooth and the health of your gums. It doesn't hurt. This is a scaler. This is the tool that dental hygienists use to remove the hardened version of dental plaque called tartar. We gently trace around your gum line and take off any hard deposits. Dental hygienists are trained professionals, and we go to school to learn how to use these tools. This is the tooth polisher. It has a very squishy rubber cup, and we use it with some special toothpaste. This one tastes like cherries. This toothpaste is a little bit sandy, and it helps us remove dental plaque off your teeth. When I press a button, the end of it spins round and round like an electric toothbrush. We tickle every single tooth until it's shiny clean. After that, we're going to have to rinse your mouth out. So we use this gadget right here that sprays air and water. I'll show you now. I'll spray some water on the teeth. There we go. Look at it in the cup. Do you see how the water comes out? To get the water out, we use a teensy tiny mouth vacuum cleaner called a saliva ejector. Remember, saliva is another word for spit. So this little vacuum sucks up water. Let's put a little bit more water in our cup, and I'll show you our bigger mouth vacuum. This one is extra special because it actually has a little mirror on the end of it. This vacuum sucks up water faster than the smaller mouth vacuum. We use that for procedures like fillings where there's more water. Next up, we have fluoride. This is what fluoride looks like in our office. Some dental offices might use a foam version or a cream or a rinse, but we use this tiny little bit of liquid, and this one tastes like bubble gum. We use a tiny little bristled brush to paint the fluoride right on your teeth. It's super, super easy. Just like that. So we paint it all over the outside and inside surfaces, and then it mixes with your saliva and protects all of your teeth. Another thing that we can do at the dental office to help prevent cavities is to put sealants on your adult molars. Sealants are super easy and they don't hurt at all. The very first thing that your hygienist or dentist will do if they're putting sealants on your molars is they'll polish the biting part of your tooth with a special sandy toothpaste, just like this. Super easy. Next, they're gonna wash the tooth off, and they'll use the air water sprayer and the vacuum to rinse the tooth. Next, I'll use air to dry the tooth. It's very important to keep the tooth dry when you're putting sealants on. So your dentist or hygienist might use these little cotton rolls to help keep your tongue and cheek out of the way. The next step to doing a sealant is to put blue gel in the biting parts of your tooth. So the sealant is going to go into the little wrinkles and grooves to help make your tooth slippery and prevent cavities. The blue gel is going to stay on for a few seconds, and then we're going to use the air water syringe and the vacuum to rinse the tooth off. Now spray air and dry the tooth. The next step to putting the sealant is to actually put the sealant in the tooth. So this is what the sealant looks like. So it has a pointy little tip that helps put the liquid into your tooth, but it's not sharp and it doesn't hurt. So now I'm going to paint the liquid onto the tooth. It goes on pink so that I can see that I fill in all the little wrinkles of the tooth. And then I use this super special light that will make the gel hard and it will turn it white. So this is a light that they also use sometimes when they do fillings. A few more seconds and the sealant will be all done. There we go. Now let's learn more about our mouth and our teeth. When we look in a person's mouth, we can see their gums, teeth, palate, which is the roof of their mouth, throat, tonsils, tongue, lips, and uvula. That's the little ball that hangs in the back of your throat. The part of the tooth that we can see when we look in your mouth is called a crown. Each tooth has roots that are embedded in bone and surrounded by gums. Healthy, strong gums are pink in color and do not bleed easily when brushed. If you brush too fast or not often enough, the dental plaque that gets left behind can make your gums red, sore, and irritated. This is called gingivitis. Thankfully, gingivitis is preventable and reversible with good brushing and flossing. Let your dentist, hygienist, or an adult know if your gums bleed when you brush your teeth. So how many teeth do we have? Babies are born without teeth and usually get their first tooth at around 6 months old. By the time you're about 3 years old, you will have a full set of 20 baby teeth, 10 on top and 10 on bottom. Baby teeth aren't permanent. At around 5 to 6 years old, kids lose their first tooth and will continue losing teeth until about age 12 to make room for their permanent teeth. It's important to keep your teeth healthy because they help you speak, eat, and save room for your adult teeth while you're growing. By 12 to 13 years old, your 20 baby teeth will be replaced with 28 adult teeth. And by age 18, you could have up to 32 adult teeth in total. Adult teeth are considered permanent, and if you look after them, they can last you 100 years. There are 4 different types of teeth: incisors, canines, bicuspids, that are also called premolars, and molars. Incisors are found at the front center of your mouth, and you will have 4 on top and 4 on bottom. They are sharp and help you cut food. Canines are found at the corners of your mouth, and you will get 4, 2 on top and 2 on bottom. These are your longest teeth, and they are pointy for tearing food. Next up, we have bicuspids, also called premolars. They are found behind your canines, and you will have 4 on top and 4 on bottom. They are small, molar-shaped teeth with 2 points called cusps that are great for crushing food. You also have molars. They have 4 cusps, and they are your biggest teeth. They help you crush and grind food. You get 4 molars when you're around 6 years old. They come up behind your baby molars, so you don't actually have to lose a baby tooth before they show up. You'll get another set of 4 molars when you're about 12 years old, and then possibly another set of 4 at 18 years old. Those are called wisdom teeth, and not everybody gets those. In total, you can have up to 12 molars. Let's look at the different layers of a tooth. This is a molar. The crown of the tooth is covered in enamel. Enamel is actually the strongest part of your body, but the acid in dental plaque can break it down and cause a cavity. Dentin is the softer layer found just below your enamel. In the middle of your tooth, you can see the pulp chamber that holds the nerves of your teeth. Nerves help bring nutrients from your bloodstream into your tooth, making it healthy from the inside out. How cool is that? A cavity is a hole in your tooth that's caused by the acid in dental plaque. If it reaches the dentin layer of your tooth, it can be uncomfortable. Cavities can't heal themselves, and they can get bigger over time. To fix a cavity, you need to visit a dentist so that they can give you a filling. Fluoride is a mineral that helps keep your enamel strong and prevents cavities by strengthening the areas that are weakened by the acid in dental plaque. Fluoride is found naturally in some places in their tap water and also in some of the foods we eat, like green leafy vegetables. It's also added to dental products that we use every day, like toothpaste and some mouthwashes. At the dental office, we give people a special fluoride treatment to help keep their teeth extra strong. Mouthwash can be a great way to add a little extra fluoride to your daily routine, but it doesn't replace brushing and flossing. It's important to spit fluoride toothpaste out after you brush your teeth. Swallowing toothpaste with fluoride in it can upset your stomach. And remember, you only need a pea-sized amount, morning and night. Well, friends, I hope you liked our presentation. It's almost over, but before I let you go, let's do a quick review of the things we talked about today to help keep your teeth healthy. We talked about how a healthy mouth is important for a healthy body, and we learned ways to help prevent cavities by eating healthy foods and choosing water instead of chocolate milk or juice. We also talked about how brushing and flossing is the easiest way to remove dental plaque. It's okay to ask an adult for help. We use a pea-sized amount of fluoride toothpaste morning and night to help prevent cavities. Don't forget to spit your leftover toothpaste in the sink when you're finished. We also learned what it looks like to visit a dental office and what you can expect when you go. They do things like exams, dental cleanings, fluoride treatments, and put sealants on your molars to help prevent cavities. Well, friends, that's the end of the presentation. Let your teacher know if you have a question to ask a registered dental hygienist.